I cure cancer all the time when we catch it. And more young guys are getting less and less testosterone made by their testicles. All the crap that is in our diet that we've been feeding our kids, it's gonna alter how our bodies are making things.
Having low testosterone, what can that stall? I've heard it affects mood, things like that. So can TRT increase your chances of prostate cancer, or?
I think guys who get vasectomies are crazy, and that makes absolutely no sense.
There is a medication that I take for birth control.
You finally get to go in there and you're like, ow,
Ow.
I spend half my life playing with it. I want to know how it works.
What's up, guys? We are back in the Wolf Den today. Today's episode is brought to you by Hell of a Spark. I'm already on 2 of these. Bro, whenever I tell you, it's made by my boy, Brody Falgu. He's been on an episode in the pod a couple times. Man, I'm rolling right now. This is literally nature's Adderall. It's all like real ingredients, lion's mane, what the other stuff was, soy-free, no artificial colors, non-GMO, gluten-free, vegan. And then every single ingredient in this thing is just literally like B12, B6, magnesium, green tea extract. I mean, you're not getting more natural than this, guys. And I'm telling you, it works. They say clean energy, clarity, and focus, mood, and stress has been helping me out. So I'm on 2, like I said. So I need another pack right now. But let's go ahead and get on into the pod. So today we got Dr. Jason Bridges with us. Urologist, right?
Welcome,
sir.
Welcome to the pod. Welcome
Appreciate
to the pod.
it. Thanks for having me, y'all.
So, you're officially a urologist, and you also dabble in a couple other things, right?
Yeah.
Like some robotics and things like that.
So urology is it's a really cool specialty. I wouldn't have gotten into it if it weren't for my uncle. He is a urologist in Baton Rouge. It's the surgery of the kidneys, the bladder. Kidneys drain urine into the bladder. So just quick anatomy. Everybody's got 2 kidneys. They say like here. They drain urine. They filter all the blood that goes through our body every 4 hours. So all the blood that goes through our body goes through our kidneys every 4 hours. And then they drain urine. Urine drains down to your bladder through 2 little tubes. The bladder then fills up with pee. When you get ready to pee, it squeezes. On us, we have long tube, some longer than others. Long tubes that we get out of.
That was towards you, Duncan.
You projecting a little bit, bud?
And
You were
then
saving that one project.
with us too, at the bottom of the bladder, so the bladder fills up like a balloon. At the bottom of the bladder, the prostate sits around that tube like a donut. So the prostate just sits around the bottom of the bladder, and every time you pee through your prostate. And then, so I'm a prostate doctor. I'm also the male gynecologist. So I'm the penis doctor. I'm the testicle doctor. So I do a lot of prostate issues, a lot of prostate cancer. That's my favorite surgery to do, robotic prostate cancer surgery.
Is that like you basically going in with like a tiny robot and like removing from a guy's testicles?
Not testicles. So testicles sit outside our body, right? The prostate's deep inside.
Okay.
So actually what robotic surgery is like somebody's asleep, and then we go attach the robot to them. So the robot comes along, and I make little tiny incisions, and the robot has little arms, and they go down. And then once I attach the robot, I go sit in the other end of the room and control the arms as they go down and do the work. And then I get the prostate out and then hook everything back up through these little robot arms, and then take the prostate out through like a little bit bigger incision. Usually it's like that big. So like guys who have prostate cancer have like a little incision like this, and then like 4 other little tiny incisions. But it used to be we had to make like one cut like this and do all it with our hands. And
That's
now,
minimally invasive.
That's what I'm about to say.
Minimally
Very almost non-invasive. Huh?
Yeah, guys go home the same day.
And it's all through cameras on the robot, or is it by sight?
So one of the incisions has the camera here, and then the other I can say, hey, can y'all take the scissors out and put a grasper in? So like one has a scissor, and I can have one that has a grasper, and I can say, hey, do something that has electric current on it so it can buzz bleeders. And so it's really cool what we do. I mean, I can talk about it for hours.
No, that's actually like really awesome. Like that's cool. Like I can't even imagine that. And then I would assume at the same time, like this is like actually kind of serious stuff. So you're actually like dealing with these people's lives at that point too, right?
Yeah.
Even
like,
if something would go wrong, while you have these.
But what I think is amazing is how precise. Like, I mean, it's got to move. I mean, when you move the actual tool that moves the robot's arms, it's got to be
That's
very
my question.
very minimal movements.
Well,
That's wild.
what are you using? Like a little bitty analog stick or something, or are you using like little Tell me.
It's so yeah, you go sit in this like big console thing, and it has foot pedals where you can control the arms and like little side pedals, and these little they're not joysticks, they're almost like handheld controller things, or like a Nintendo Wii, like the Wii joysticks, but it's attached to the console, and so as I do like this, you see the robot arm in there do like that. Right? And so I just do like this, and and then there's another arm. So you have the camera, my two arms, and then there's another arm. And so I can hit a little button and then control this arm while this one's still. And then I hit my little foot pedal, and then I'm controlling this one. So like if you need to hold something and hold it like that, I can.
Dude, that's crazy.
So it's almost like y'all giving y'all extra hands.
Exactly.
That's actually really cool.
That's exactly it. And then they have wrists on them too. So like it's just like putting my hand in here, where you can go like this and get around things. Before, minimally invasive surgery was laparoscopic. So laparoscopic just means you fill up so right now there's your guts, you have your skin, you have your layers, then you have your guts, and there's no air in there. So the first step to our procedure is I put it's like we call it a Varus needle. We put this needle in there and we blow the belly up with air so we have room to work. So like people's stomachs get like this big. My stomach would probably be like this big with air. And then I attach the robot so I have a lot of room to do things.
So you see that, Austin? Your stomach, you're going.
What? Yeah, okay, damn.
I got no on the talk.
That's making me squeamish, dude.
Yeah, it's really cool, man. I have friends and not friends, but like friends' kids who are in med school or who are trying to watch. Like I love teaching, and so people come in there, and I'm always like, okay, if this is your first time in the operating room, let's put a chair right behind you, just to make sure you don't.
That would be me.
Oh,
I would faint immediately.
Dude, in med school, like even in med school, like we would be on surgery rotations, and there would be med students that would just be like, and they'd pass out.
That's crazy.
But not everybody's meant for surgery,
My fiance, she's in dental school at LSU Dental, and she's like horrible with blood and all, but she can work in people's mouths all day long.
I can't.
And I'm just like, what? And like she's like they bleed in the mouth and all, and she's cool with that. But then like whenever it comes to like you cutting your arm or something, she's like freaking out.
So do people overcome that when they pass, or like once the passing out, y'all figure they're like, oh, this ain't for me.
They're so embarrassed. Oh no, they're like, it ain't for me.
Okay.
Like they're.
I didn't know if they're like, I really want to do this. Like I'm gonna get over it, kind of thing. No.
No, and I think there was one person that I can remember that was. Okay, no, I promise, guys, I'm good. And then we were all like, it's okay. You can do something in medicine without blood. Like there are things that people can do without seeing blood. It's just not meant for people. There's even like PTSD. Like I've had reports of people having real PTSD from getting in the operating room and seeing guts alive, and then they can't sleep at night.
So tell us this: how do you handle that type of pressure, and how do you kind of deal with that? If you've
never been a thing, man.
Never been a thing for you.
Never been a thing at all.
If there's guys that's dealing with low energy, low focus, 18, 19, 20, low motivation, low drive, what's some things that, their issue might be low testosterone. What's some things that you would recommend, like, maybe it'd be natural, but like how can they detect those things? Is it just from what I said, the low things, or?
So more often than not, if you're in your early lifehood, so like if you're in your teens, 20s, and you have struggling with low energy, decreased focus, it's probably not hormones. It's probably not your testosterone, because our testosterone peaks when we're in our teenager years and it slowly goes down. Now, we did talk about the incidence of low testosterone when people are younger is getting higher, so it could be. But my first thing would be to get 8 hours of sleep, drink lots of water, eat a balanced diet, you don't have to do supplements, but do a multivitamin and just try to be healthy and be healthy and take care of your body, because we all know what it means to be healthy. We just don't do it, right? Mm-hmm. Like I need to sleep 8 hours a night, but I got 4 hours last night. Mm-hmm. Why? Because I was up too late. And I shouldn't be. And that alone can decrease your own testosterone production. So that's why I would highly suggest doing all the natural things you can on your own, because just being healthy, our bodies will make your own testosterone go up.
What are the main causes of low testosterone today?
The main causes of low testosterone are mostly unknown, because what low testosterone is our testicles just aren't functioning the way they used to. And so if there is a cause in our body, that's usually more rare, like a cause of a brain tumor or some other kind of tumor in our body that's secreting a hormone that stops testosterone from being production. But most of the time, it's just the testicles aren't doing their job. They just aren't functioning right. And we can't figure out why. So that's why it's called TRT, testosterone replacement therapy, because we're not telling your body to make more, we're giving you more.
So with there being such a low rate of urologists in the area, what would be, 3 things that you would tell guys or even girls, whether it be, because I know there's male gynecologists, right?
Mm-hmm.
Right.
Mm-hmm.
So guys or girls, what would be advice that you would give them, to pursue that career or to pursue that dream of becoming a urologist?
So what are some good pearls to get somebody who's interested in the field to get into the urology field? Unfortunately, urology is one of the hardest specialties to get into in med school. And it is...
Well, there you go, though. You just said one of the hardest. So all those people who think they're the best of the best,
yeah,
put it to the test.
Put it to the test, for real. I mean, when you look at the difficulty to get into residencies, I mean, there's brain surgery that's really high. Obviously, you got to be super smart and stuff. Dermatology is really high. Why is dermatology high? Why do you don't have to be that smart to be to look at skin? The problem with competitive specialties is the income to lifestyle ratio, and for urology, it's pretty high, meaning that I work from home most Fridays. I have a great schedule and I have a good income that's not shared by a lot of doctors. And so that's why it's hard to get into. And so my suggestion would be just to be the best student you can be and get the best grades you can get and do your best and hopefully apply and get in.
What kind of mindset does it take to get through medical school, specifically into urology?
I don't know what kind of mindset it takes to get into medicine and specifically urology, because I was an athlete my whole life. And that is all they asked me about on med school and residency interviews. They didn't ask me about my test scores. They didn't ask me about, my extracurriculars. They asked me about my college athlete experience. And it's because if you have the same things that it takes to succeed in the sports world, that like everybody thinks you can't do it. So I just got to do what I got to do. I got to put in the work. Like those same things are the same things that you need to be successful in medicine as well. And so I have a huge affinity towards student athletes. Like I love student athletes. If you can, because if somebody can be smart at school and do well on the court or on the field or whatever, they can be good at medicine.
We talk about that all the time on this.
How did your mentality in athletics transfer into your current life and work as a doctor?
How did my mentality transfer from sports to being a good surgeon? And I think the practice makes perfect, the repetition and the finding the joy in the mundane is something that has really been key for me. For instance, being outside shooting all night long, getting your form right, is just like staying up all night studying, right? You're so dedicated to something that you want to be the best you can absolutely be at it. I want to be the smartest I can be at it. I want to come on a podcast and not sound like an idiot, so I'm going to make sure I read, and do all my stuff. And it's that kind of competitive nature that has allowed me to be good, I think.
That's actually great advice. Yep. Do you have anything that you want to ask?
No, I think I pretty much covered everything.
You need a couple more to hit.
I was about to ask something. He kind of put me in a daze right there whenever he was talking about that, because that was actually good.
What's the biggest struggle you faced in getting to where you're at right now,
getting to where I'm at.
Professionally, and getting.
Well,
to where
no,
you're
yeah,
at.
I would say, what's the biggest struggle you face now with your patients as far as that whenever they come to see you? Is it them getting the full information out of them?
No, the biggest struggle I have, the hardest part of my job is also what keeps me living a you only live once kind of life. Like I could die tomorrow and I'll live like it, right? And I have to have hard conversations with grown, strong men, and I have to tell them that they're dying, or I have to tell them that they have cancer. And seeing what that does to a grown man who was 5 minutes ago just fine, right? 5 minutes ago he was ready to conquer the world, seeing and walking these men through the process of confronting their own mortality. Like I could die, and seeing what that does to somebody over and over and over again is difficult. But where I was going with that is more difficult to like be present and be like, I'm not telling you you're gonna die, but like having that conversation with you and then getting done with that and being present and there for you, and then walking out of that room and walking into your room to be like, hey man, that Viagra's still working? You good?
Yeah.
And then it's just like, I have to act like everything's
Chill and mellow.
chill and
You gotta
good.
change it up on the fly.
Yeah.
And then the next one is you're an 85-year-old lady with recurrent UTIs, and I gotta go be, primmed up because you're 85 and you don't want to be. And so it's that part of kind of being a chameleon during clinic has been difficult. It's still difficult. Yeah, good question.
How do you deal with the uncomfortability some people have talking about the lower regions and sexuality and things like that?
Directly. Like I don't let
Can't
them.
put no BS. Huh?
Yeah, I don't. I think I get told at least 2 or 3 times a day. It's like, Doc, I like you. You don't mess around. Just because I'll just be like, the 85-year-old lady. I'll be like, is your vagina dry? But I really
Yeah.
None of us
funny
could be
because,
doctors.
You
None of
gotta
us could be
straight up
doctors.
be, yeah. Just,
I mean, that's what we're talking. We're talking
Yeah.
about your UTIs, and if
Yeah.
you have a dry vagina, you might need estrogen cream. And then they're like, you know what? It does hurt when I have sex with my husband. And I was like, yeah, it probably does. You need some estrogen cream. And then they love me because their husbands aren't torturing them anymore. They're actually having fun again.
That just don't affect you.
It doesn't affect me. I've always been talking about sex and relationships with all my friends, even before I'd even seen a vagina. I was telling my friends how to deal with them in 6th grade, and I was like, why are people trusting me?
They never going to him for all the tips. Hey man, so what? He was the guru.
I hadn't even kissed a girl. I hadn't even like seen anything. I was just telling people
Like the
about
movie
stuff.
Superbad, he's drawing. He's selling pictures. He was selling the pictures.
Selling a
I
diet.
got that good.
I got
You
that
come
good
over here.
Benny one right here. But yeah, it was, and so people have been talking to me about
Dude, that's
sex and
crazy.
stuff my whole life. And I've been talking about it my whole life. I guess that make people feel comfortable or something. I think it's a little bit of a talent I have.
Oh, it should be a comfortable topic to talk about. I mean, it's a natural.
Not for a lot of people.
But
though.
what we talked about whenever we had a girl in here a few weeks ago, and we were even talking about like sex shoots and stuff like that, and like it's just like, dude, it's a normal part of life. Everybody does it. You need to do it to continue life. So it's just like people should be more comfortable about having those conversations and all. But I can see where you're coming from, where if a male is struggling with his own self, because if he's having some of those issues like you talk about, like erectile dysfunction and things like that, I can see where that would deter some men to want to come and talk to you. But I mean, dude, in my opinion, if my shit ain't working, I'm going to see you ASAP.
I mean,
and you get this shit working ASAP.
Especially with the older
Like-
crowd, I'd imagine you probably run into this because you were talking about prostate cancer and detection, early detection, especially since it's happening younger nowadays. Do you run into, with older crowd, people just not wanting to admit it or not wanting to look at that, and then it's too late by the time they find out?
It's all over the place, man. The saddest situations I get are when there are guys who just don't want to go to the doctor. So I tell the statistic all the time. Married men live longer than single men. Married women live shorter than single women. And why is that? And like, we don't really know, but one of the things that I see all the time is that men are only coming to me because their wife brought them in. Their wife is like, I noticed he's waking up a lot at night to go to the bathroom, or his stuff ain't working. He's coming, and the guy's like, man, I'm good. And I'm like, all right, do you need some Viagra? And he's like, actually, can I get some of that? And it's like, why don't you just tell me? Like,
Yeah.
I can do all this stuff, but I get it, man. Guys don't want to talk about stuff. Guys will have cancer. I'll diagnose them with cancer, and they won't. Like, I've seen a guy have stage 1 cancer. I'm like, I can cure it. Let's do it. Nah, I'm just not ready. And he just delayed it until it was too late, and I couldn't cure it. Now we're just slowing it down. And like, and men just
progressed.
It progressed, because it was like, when you catch cancer early, you can cure it. Like, people always talk about, we need to get a cure for cancer. You got to get a cure for cancer. We have lots of them. We have lots of cures. I cure cancer all the time when we catch it in time. And that's the hard part, is catching it in time and knowing who to look for it in. And that's why it's so hard.
You see, that's actually crazy you say that, because I'll just say this a little bit about my mom. My mom just had a glioblastoma on her front, right? And it was present on her frontal lobe. And my mom's side of the family struggles with Alzheimer's, like my grandma and all. So my mom, she started like messing up at work and stuff. And she was thinking she was getting like early onset Alzheimer's. My mom's like not even 60 years old yet, if she even is 60. So she's like stressing and freaking out and all. And she's like, her company's, working with her and telling them that, hey, we gotta give you this other position so that you don't have to worry about the stresses of remembering all this other stuff and all. And then like they figure out, they were like, nah, like my mom was like, I don't think that's fair to y'all, right? Like, I'm gonna go ahead and just take the early retirement and figure out what I need to figure out. A week later, she passes out and is vomiting and stuff. And these symptoms have been going on for like almost a year now. And she never wanted to go to a doctor because she was scared that the doctors were going to tell her that she had early onset Alzheimer's. And the only reason that we went to the hospital was because my sister Brooke was like, nah, screw that. You're going. Like, we're taking you. And
Did they catch it?
Yeah, well, it was stage 4. And so we lucky that my sister is where she's at, right? I told you about her.
Yeah.
She's a pediatric, she was pediatric, but she's a nurse practitioner now. And so she knows a lot of people. We got my mom in at Our Lady of the Lake, like, who's y'all have like 2 main brain surgeons, right?
Yeah, I'm not sure. I'm the opposite end of the body, so I don't
Okay,
really...
yeah. So I forget his name, but they literally had her in. We found out on Thanksgiving Day, and they had her on the operating table the next night. And so they were able to, they dug it all out. She's on like her last round of chemo and radiation right now. I think she did radiation first and then chemo, and then so now she's pretty much good, but they still got like a little spot or something like that. They said, so.
Now, after the surgery, like you would do on, say, prostate cancer, are you still linked up with the patient following that when they get into the chemo stage and everything?
Yeah, so, well, ideally, I tell all the guys I do prostate cancer surgery on, ideally, I get to it and you don't need chemo, you don't need anything else. So, like, ideally, I do the surgery and that's it. And then I get to know these guys for life, because I saw a guy recently, and this was crazy. I saw a guy who had his prostate taken out in 1998, old guy. So 27 years ago, his prostate was taken out.
What was the reason for that?
Cancer. So he had cancer. That's the only reason we remove prostates, is for cancer. And so he had the old school open surgery, and he came to see me because he was leaking a little bit, and I help with that. Like, I can fix guys from peeing on themselves. And so, of course, I was just like, well, let me just make sure your number's good. You had cancer 25 years ago. There's no way it's come back. And his cancer had come back. After 27 years, his cancer started to come back. It's like prostate cancer is one of those things that I'll never tell anybody 100% or 0% in medicine, because it's just, you never know.
So is that, I'll say, a lot of guys in this generation or these upcoming generations, I feel like they struggle with like motivation and just like actually getting out there and actually doing things. Do you think like there's an increase of more guys having problems with that at a younger age these days?
100%.
And what's the reason? And like, what do you think these guys can do to overcome that? And, like, do they come see a doctor? Or, you know what I mean? What?
Yeah. So we touched on a little bit about some testosterone stuff. One of the things that we know is getting more and more prevalent. So like, more and more young guys are getting less and less testosterone made by their testicles. So like, basically, it's a natural progress for as you get older, things just don't work well, right? So like, we're older. My knees are not as good as they were 20 years ago. Same with my testicles. They aren't making testosterone as well as they were 20 years ago. And so what we're finding is that shutdown, that's like a normal process, the testicles of normal aging, is happening earlier and earlier. And we don't know why. And it's really going to be hard to pinpoint a reason exactly why, but it doesn't take a genius to put 2 and 2 together and know that you have all these hormones that we're pumping into our food.
Thank you. I was waiting for you to say it. Thank
all
you.
These, like, we're getting hormones. Like, have y'all seen the chickens that we eat? Have y'all seen them living?
Mm-hmm.
You're preaching to the choir right now.
Have you ever seen one of the chickens run around? They look like
He
breasts are.
He has his own chicken. He has his own homestead and all because of, I would assume, some of these reasons, right? But
Yeah, we eat fresh eggs.
He don't kill his chickens to eat his chickens, but they eat like fresh eggs.
Oh, we fixing to do the broiler chickens.
Oh, yeah,
for 4-H. Yeah,
hell yeah.
I just we're about to get 100 of them. I think.
What do you call them? Broiler chickens?
Yeah, the broilers. It's a little smaller, but you feed them like nonstop. It's crazy. So my kids are in 4-H, so we do the. So basically, I keep them in a stall, and you feed them like corn, and you even put maple syrup and all kind of protein and stuff like that, and you just feed them like healthier stuff, until they'll get big. Sometimes they'll break their legs
because they're so big.
Because they're so big. That's how you kind of bulk them up. And you got to show like three
instead of probably popping them with hormones.
No, you don't put it's all natural. It's all corn. It's all.
That's what I'm saying. That's where he was getting. That's where his point was going.
But it's pretty cool. But it's a whole process. Look, me and a friend of mine, he got me into doing it before my kids were able to do the 4-H. And look, that's a process. We had the whole machine that spins. You got to dip them in water, and we cut the necks, do all the stuff, dip them in water, and then you spin them and it defeathers them.
Yeah, it's crazy.
And then you process them. You just clip the legs and you're ready to go.
That is a whole different world.
Hey, look, we did like 60 of these things, and look, it's a mess.
It's crazy.
But I mean, it's good. It's like better. It's.
I bet it tastes better too.
But yeah, there's it's.
And the eggs are really good too. I hear like eggs you can tell the difference.
Yeah. So like right now, matter of fact, I've told this before, but my kids got their own little egg business. So we got we got like 80 chickens. Okay, so right now they kind of slowed down because of the weather, but normally they get like 5 dozen eggs a day. So we'll go to the barn and clean them up, and I built them a little stand at the end of our neighborhood. So our property's at the end of the neighborhood. So they got a little stand. People can walk in it. They got a refrigerator with drinks and all the eggs and stuff, so they can buy the eggs. And they got a little money box, an honor system. So they go in and pay for the eggs. Look, they were making like $100 a week sometimes. Yeah, I mean, look, they're
killing that.
They're like 8 and like 6 years old.
Teaching them business, eating them healthy. That's really good, man.
Yeah.
That's really good. But I mean, most of the people, right? Like I'm a city boy. That's why I don't know anything about this. I'm a city boy, and like I get food from grocery store. I haven't seen like the whole process of killing a chicken. Like I was like, I don't know if you saw me. I was like listening. Like that's
well, look, but you know what's crazy? Going back to the egg, I bet you don't even know this statistic. So we were kind of looking into it after, but like the eggs when they get to a regular grocery store. Like, like they say that they are already pretty much 60 days old by the time they get
to
the stores.
They're 60 days old. They're bleached.
Before they actually get to where you buying them. So, like...
Austin got eggs producing
Hey, look, we'll
brown,
we'll go get the
yellow.
eggs. And, like, sometimes we'll have, like, the eggs that day. And it's like, every day we picking 5 dozen eggs. So, like, you can eat them as fresh as you want.
And then
it was crazy. People come all over and they'll come drive and pick up the eggs and got return customers every week.
The reason that them eggs that they able to keep them in the store so long is because they bleach them and use all this other stuff to preserve them, and that's what you're getting by the time. But I want to hear where you're going with all the hormones and stuff popping in, like so.
Well, so if you think about it, I mean, I was raised on McDonald's. I don't know, I'm not on McDonald's. My parents fed me a bunch of stuff, but like all the crap that is in our diet that we've been feeding our kids, it's like it's gonna alter how our bodies are making things, right? And when you understand how hormones are made, how everything's made in our body, it's when you have a lot of the building blocks of whatever process. So like our bodies are like really eloquent warehouses or plants, processing plants, and so our bodies take all these individual molecules and proteins and they package them up and whatever you need. So like if you need a lot of testosterone, they'll take these things and make testosterone. If you need a lot of estrogen, they'll take these things and make estrogen. If you need whatever, our bodies are really good at taking these individual molecules and then packaging them up. First, we break them down to individual molecules and then package them up. And so if you have a lot of one kind of molecule, our body's going to be like, oh, I guess we got to use it. And so if we're pumping a lot of hormones and our bodies are breaking them down, we're going to also make more hormones before our bodies have the chance to really understand what's going on. And that messes things up because the way hormones work in our head, we have a piece of our brain that's constantly sampling what hormone it needs. So let's just talk about testosterone for a second. So testosterone, we have a part of our pituitary hypothalamus. We have a hypothalamus and our pituitary gland up here. Hypothalamus is constantly testing how much testosterone's in our blood, and then it sends a signal to the pituitary gland that says, make more testosterone or make less, or you're doing right. So if all of a sudden there's a lot more testosterone, our brain's going to say, shut it down, stop making.
That's what I was about to say. Is that the reason why whenever like guys, they start juicing and stuff, then they stop, their body is just, sometimes they don't even produce testosterone no more because they like what we was getting from this third party, right?
Mm-hmm.
And now where it's like it's going, so like your body like just almost don't know what to do with itself, right?
Right, and the exact reason, that's exactly right. The exact reason is because the signals, so our brain then sends signals to our testicles that says make more, make less, or do whatever. And so if you are on testosterone, your levels are high for a while, your brain is going to say, oh, testicles, you're doing too much, shut it down, you're making too much. And if your testicles receive that signal for long enough, they can shut down and stop functioning testosterone completely, which is why people say you do cycles, which, why you do a little bit and then you come off of it, you do a little bit, then come off of it.
And do you have steps to recovery after for people when it does start to shut down? So
I always tell guys before I put them on testosterone that there's a chance that if you stay, we don't know how long the signals that your testicles need that say shut it down. We don't know how long your testicles need before they completely shut down versus his versus mine. That's
literally what my next question was going in to ask you was like, do you have like a safety protocol like to a guy gets to a certain age? Because obviously you're gonna stop producing testosterone at some or is that not the case?
It depends.
Can guys go till all the way till they die, like at 90?
They can.
So that's what I was about. Yeah. So some of these guys, like you see on the other podcasts, like Joe Rogan and all, like they talk about like some of them do like TRT replacement, just to, keep them, nice and built and looking good at their age, at 60, 50, whatever they are. But if you don't need that, then
if you don't need it, I'll tell guys if you don't need it, don't take it because it does potentially shut down everything in the long run. But if you have low testosterone and you need it, it really changes people's lives. Like I've seen guys going from the brink of divorce to like now they're in love again with their wife and everything's good. I mean, I've seen it really change people's lives. And so I'm not trying to talk people out of it ever. I'm just trying to make sure you know what you're getting yourself into. And usually when I tell guys that they're going to be on it, I tell them you're going to be on it for the rest of your life. So like if you like the result of it and you like how it's helping your life, this is a lifelong thing that you're going to be doing. So just make sure you're making this decision right.
So because people, I mean, and we talked about it, you talk about the guys trying to look juicy, and yes, a lot of people get on testosterone for that, and that's the first thing that comes to mind. But could you talk to us a little bit about what else does that affect, apart from just physically how you look, but having low testosterone? What can that stall? I've heard it affects mood, things like that.
Yeah, so what... Great question. So like what does testosterone do for us as men, right? It peaks in puberty. Like our testicles production of testosterone peaks in puberty. That's why our voices change, and that's why all of a sudden, like, girls are hot, and we're getting erections randomly because, like, our testosterone is super sky high.
Find them in your waistband and everything.
Right. Exactly. It's like, teacher, please don't make me stand up right now.
Walk down the hall.
Exactly. And so that's why we do stupid stuff, right, when we're teenagers, is because testosterone does affect your brain. It affects your decision making, and it affects your cardiovascular output. That's why teenagers can lift a lot and they gain a lot of muscle. And so it's the natural cycle is for it to peak in puberty and then slowly go down over the course of life. But we know there's some men who, like, there is an 80-something-year-old guy who is having sex, no Viagra, this guy, I don't know how he's doing it, but he's running around horny as a bull. Right?
Probably because he
That's
grew up
awesome.
eating food without all the hormones and stuff.
Probably. But we also know guys. I mean, there's stories all the time of kings who get to the throne and they are just, they're imps or they're like really meek people. You read about that in history books. Like certain kings are real manly and certain kings are not. And people that they talk about, not everybody has high testosterone. Back to your question about what it does for us. So it affects everything in our body. Hormones affect everything in our body. And so when you lose it, it affects it negatively. So it affects mood negatively. It affects your libido, your desire to have sex. It affects your erectile function. It affects your energy. It affects your bone strength. If you have low testosterone for a long time, testosterone and estrogen both put increased mineralization of the bone. It makes your bone stronger. So when you have low testosterone, it really weakens your bones. It's so much so that when we take away testosterone for prostate cancer, I'm going like way down some rabbit holes, but when prostate cancer spreads, prostate cancer is fed by testosterone. So the first thing that we do when stage 4 prostate cancer or in high-risk prostate cancer is we remove testosterone from your whole body. We give you a shot that takes away all the testosterone in your body. So it goes down to 0. But it makes the cancer shrink up a lot. So it makes guys live a lot longer from the prostate cancer. But their bones get really, really, really weak. And that's one of the things that testosterone does for our bodies. It makes our bones strong.
So can TRT increase your chances of prostate cancer or?
No, great question. Great question. So testosterone does feed prostate cancer, but it doesn't cause cancer cells. So testosterone stimulates the prostate naturally. It's what tells the prostate to grow, but it doesn't cause cancer. If you have cancer and you're taking testosterone, it'll tell that cancer to spread like wildfire, but it doesn't cause cancer. So that's why when you get started on testosterone, they do a lot of blood tests to make sure you don't have prostate cancer. Then it's like, okay, you don't have cancer, you're good, you can get the testosterone.
It feeds other kinds of cancers or just prostate?
Yeah,
So my question would be, and this is on the same subject, but it's a little different. Guys who get vasectomies.
Mm-hmm.
You're a doctor, so maybe you may be able to sway my opinion if my opinion is wrong. So let me tell you my opinion of that. I think guys who get vasectomies are crazy, and that makes absolutely no sense because at the end of the day, is that not what like feeds our drive to be men? Is like that, and then what they say is that they cut this tube or they cut the sperm or whatever from being able to do whatever it does. Then where does that go after? Into your bloodstream, right? No. Okay, so explain to me, and tell me why a vasectomy is safe because I don't believe in them.
Okay.
I would never get one personally. And if you can tell me some information that would make me sway and say why it would be a healthy, beneficial thing, then I might start to be
well,
like,
you need one for the good of society. But why would a normal person need to get one?
Do some credit. You'll get one right now.
So
and you might not even be pushing it for. I'm just saying, you know.
I love vasectomy. I would have given myself one if.
That's crazy.
That is like on your own.
Dude's on a robot.
He's like, no, it's good. I got it here.
I got it.
He's like,
Started like a video game on his
stay
own.
in the other room, girl. I got this shit.
No, I really think I could do it myself because we do it with local anesthesia, meaning that we just numb you up and then make a tiny little cut. It's a cut this big. You could even do it without a scalpel, without making an incision. So what we're doing with vasectomy, testicles, everybody's got 2 testicles. They sit down here in our nutsack, right? We have a spermatic cord. Our testicles are attached to our body via this thing called our spermatic cord. So it's one long tube. This tube had blood vessels that goes away from the heart. Then the testicles get the signals to make testosterone, and then testosterone comes back to our blood in our body this way. It also makes sperm. Testicles make sperm, and there's a separate tube that runs along the side of this cord. So what we do with a vasectomy is we just pull it to the skin. We numb up the skin, pull the tube out, cut off a piece, burn each end, and put it back in. Right? So all you do, it's crazy, but all you're doing is interrupting the flow of sperm. You're not touching testosterone, so you're not touching anything that makes you a man. And 95% of the fluid that comes out when you have sex is not sperm, right? So the most of the fluid that comes out when you have sex is prostate fluid. That's the fluid that gives the sperm the juice and the food and energy to go swim and get to the egg. So after vasectomy, you're still nutting.
So you can
Right,
still you can still get that money shot.
Exactly.
but my thing is where is the sperm that's supposed to be getting produced from that? Where is that going? Because is that not getting discharged somewhere? Like,
No,
or is it not staying in your?
they just stay down here, and it just kind of gets backed up, and then they stop producing sperm.
Because it knows it's like
Yeah,
we
it's
got
done.
sperm
It's like,
here.
there's nowhere to go.
And you can reverse it later? Or?
You can reverse it because really all we're doing is cutting out a chunk. So technically, you can make a bigger cut and then just like hook them up. You can do that. The recurrence rates though are lower the further you get away from the vasectomy.
Mm-hmm.
So like the longer you get away from a vasectomy, like years and years and years, our bodies are really smart, right? If you're not using something, your body will be like, yeah, you're not using that.
You don't use it, you lose it.
Yeah, our bodies will just kind of slowly you're not using this, so it'll slowly make it go away. So after a vasectomy, the longer you go, the longer the tubes, just like you're not using this. And so that's why they say be triple dog sure that you're done before you get a vasectomy.
So as an alternative, I saw this, and it might have just been a meme flowing around, but you would know. They had this procedure they were working on that's like a vasectomy, but it's a switch they put in, and you can literally press and turn your balls on and off.
Crazy.
Oh
Clap
my
on,
God.
clap off, get them going.
Yeah,
Is that's real?
I read about that. It's being studied whether or not it's gonna be. So it's hard, right? Because my little research. Everybody's got to have a research project when you graduate residency. So my little research project was about. There is a medication that I take for birth control, which is crazy, but there's a medicine that works for male birth control. We've had it; it's been out for 40 years. It's not for birth control. It's a medicine that helps you pee, but as a byproduct, nothing comes out when you have sex, like nothing. So you get the same feeling. It feels I can tell you, it feels the exact same, but just nothing comes out. Birth control, right? So I take it for birth control.
That's crazy.
And so the hard part is my research project was going around to the gyms and just talking to guys our age and just be like, hey, if there was a male birth control, would you take it? Most men are like, probably not. So it was like only like 50% of them said they would. And then when I told them how it worked, and they're like, so you no nut? Hell no, I'm not taking it, right? And so only like 20% of them said they would even take it. And I also did a little research project, and I talked to women, just like 50 women, and I asked them if there was a safe birth control product for men, would you allow your person to take it? And then most of them were like, absolutely, hell yeah, it's their turn. But then it was like, would you still take your own birth control? And they were like, absolutely. I don't trust that guy to do my thing. So we'll never really have. There's not
That's
a market.
a good point. That's actually a good point that you just said. I didn't even think about that. Like,
Yeah, because
like most dudes don't even fucking brush their teeth at night.
Exactly.
Like, just being honest. So you think that
Exactly.
they're really set on.
And women know that. And women know that. You think a woman's gonna be like, yeah, oh, you took that pill last night? Okay, go ahead, do everything. No.
Yeah.
You know, like,
You gotta tell the women, crush it up, put in his eggs,
yeah, you can do that too.
give him a cab fare, you good.
But
well, I heard about that, and the reason I thought like I was one of the people that would have said, hell no, I would never do that. My reasons being is I didn't realize that it's been 40 years of it being done and that it's been around. My thing would be longevity. How would this affect me in the long process of things?
yeah, it doesn't. I mean, after the medicine's out of my system, you're 100% good.
And you're just good to go.
Good to go.
That is crazy.
Yeah.
Why is that not like? Why is that not more?
You don't hear about it.
Yeah, why is that more not?
I guess it's
like,
not. It's
well,
not
It's
marketed.
not a popular because of the things you just said,
Because the
basically.
thing I just said, right?
Yeah.
I mean, because they know they're not going to make any money. I mean, our country does everything for making money, right? Nothing
Yeah,
happens in our country without is this going to
Oh,
make
my
money?
bad.
and so like there's no drug company would be like, yeah, the first thing they do is like, is this going to make us money? Not does it work? It's like, how can we market this? And then they say, okay, now let's do some research on this drug.
And then especially since you only got probably like 20% of the guys, then they like,
And women are still going to take their own stuff. They're not
Correct.
going to trust stuff. So like,
why waste the money and
It's getting
resources to
a
put it
little
into
redundant
it to
in that
something
case.
that's only gonna be a quarter of what we already,
and that's why I don't. So where I was going with that, I don't think that little switch thing is gonna. I don't think it'll ever take off because I don't think people will. Yeah, it's gonna require a lot of initial investment, and then I don't think people are gonna make their money back. Because like, would you? I don't know if I would.
No, that's experimental.
I mean, if you could hook it up to like a Neuralink and control it with your brain.
Yeah, but then who would control it?
Yeah.
Like, and then would your girl really be like, okay, I'm not going to take my birth control. We don't want to have kids, but I'm going to stop my birth control because you have that thing in you. Like, no woman's going to do that.
You had that light switch.
Right. You got that light switch, so I'm just going to stop my birth control. Like, nah, they're not going to do that. And so, like, I don't think that product's going to take off. But the way it works, though, the idea is instead of permanently cutting out a chunk, they have like a compression thing that stops the flow. And then you can switch the compression off. You can, like, flip the switch and it opens back up. So then the flow goes back. I also don't think it's going to work because if you put it down here, there's still a long tube that goes all the way around, back to the back of the bladder, then back to the prostate, and then when you have fun, it comes out. So even though, like when I do a vasectomy on guys, I cut out the chunk here, I tell them you have to have 15 to 20 ejaculations before you're sterile, protected ejaculations, because you got to get all of this sperm out before nothing is coming out. Does that make sense?
Yeah.
Mm-hmm.
So like you flip the switch off, how long do you need before you're sterile? So I flipped it off last night. Okay, now you gotta go jack off 15 times, and then you can have sex. All right, like it just doesn't make much sense.
That's a marathon.
By the time you do it, you'll be hurt and it won't even be fun.
You're gonna need some packs of honey. You're gonna need a honey pack. You're gonna
A lot of
need
lube.
a lot.
A lot of lube.
You finally get to go in there and you're like, ow,
Ow.
ow.
Exactly.
You might burn that thing up. That thing.
Yeah.
Serious chafing issues, bro. Well, we coming up to that 35-minute mark that you were saying.
Already?
Yeah, I know. Do we have
Flew
fun?
by.
I know it flies by whenever you're having fun.
We gotta do this again and do it earlier.
Oh yeah, no, we could do. We having fun with
We
y'all.
clearly have a lot of
Yeah,
questions
yeah.
about it.
No, I could talk to you for this about days, but
So I had one more
Duncan's
question
really interested.
specifically.
Duncan must got.
I'm curious, dude.
I'm just gonna get a card after. He's like, I need
I
you
spent half my life playing with it. I want to know how it works. So, not so much on the birth control stuff, but going to kind of a different topic. You were talking about working in, it was robotic surgery. Is that the official name for it?
Mm-hmm.
Is that something that nowadays everyone is learning when they go through med school to be a urologist, or is it a specific kind of certification and class you had to opt to take on your own?
And then how long did it take you to do that? Also,
Great question. So when I was in residency, I trained in Mississippi, and Mississippi is not the cutting edge leading.
it just came out as dumbest state in the country. Yep,
man.
Louisiana second.
You're from Mississippi?
Yeah.
Louisiana's number 2 though. Louisiana's number 2.
And so when the robotic surgery's been around, I think since the early 2000s in urology, and I graduated residency in 2015. So I trained on the robot, meaning like I had doctors who had been doing the open surgery, and so I learned how to do the open surgery with my hands, and I had doctors train me how to use the robot. So I got the best of both worlds, and when I graduated, I was like, man, this is great. I'm gonna be doing open surgery and robotic surgery. I haven't done a single open surgery since I graduated.
Yeah, but it's still probably good that you know that, just in case. What if
Maybe.
robots fails? What if?
So
Yeah,
exactly. So there's been a lot of debate in urology training about like we need to make sure we keep guys around who know how to do the open surgery, because what if the robot fails? It hasn't. I mean,
yeah, knock
Right.
I knock on wood.
But there are people coming out who have never seen an open surgery. Like they've never seen a big, you make a cut surgery, and there are people coming out of training who've never done that, and they might not ever have to.
They don't have like I was assuming in medical colleges and stuff, like big test dummies with like a full track-on system that they can actually practice that, so they don't have to practice it on a real human that actually has the problem. Or
They
is
use
that not a thing?
pigs
Is that
probably,
not
huh?
We have
possible?
cadavers.
Oh, so I can use so I can.
That's not the same.
Okay.
You remember we were talking about a little bit earlier about how people like see blood and then pass out.
Right.
So the person who was the best in our anatomy class, the first year anatomy class, I don't know if she was the best. She was like high up there. She was on anatomy, gung ho about surgery. She was the one who couldn't handle the live blood, right? Because it's different when you have a dead body that's been sitting in formaldehyde. It's different when you see the blood vessels, or you see a cut artery, and you see the blood squirt, right? Like that's different, and it does something to you, I guess. So it's just different, man. You have to do it on live people. Training on the robot is a lot easier because they have these dual consoles. And so like they'll attach the robot to the patient and like I'll go sit over here and then the trainee will go sit over here. And they can see how I am moving the things because it's like when I move it, not only does the robot arm move, but their joysticks move. So they get to see, oh, that's how he did the thing. Yeah. Yeah. So to answer your question, man, I'm sorry, I'm talking all around. To answer your question about training, so I got to be trained on both, and I was confident enough coming out that I knew what I was doing. And so I didn't have to go to a fellowship. So you have 4 years of med school, then 5 years of residency. Some people like to go do a fellowship, which is 1 or 2, maybe 3 years of just something specific, like specifically robotics. I didn't do a fellowship in robotics. I didn't have to. I do normal robotic surgery, but there are some crazy situations, like these people who do fellowships, they do, robotic surgery after all kinds of accidents and scar tissue. So they do crazy, like weird stuff. I don't do like crazy weird stuff. I do kind of the bread and butter. Oh, you have a prostate cancer? I can take it out and deal with it. Oh, you've had prostate cancer after you got a motorcycle wreck, so your anatomy down here is all jacked up. Like, you're going to Houston. Yeah. Like I'm not doing that.
Right.
Yeah, good question, though.
Well, we appreciate you coming on. We kind of wrapped up that time, but we definitely want to have you back on here so we can get a fun podcast.
I want to do it again, man. This is great. As you can see, I can talk.
No, we love the information. I mean, it's all great things I feel like our viewers are going to get a lot of good information out of this, especially our male crowd, especially with dealing with.
And we a bunch of guys, so we don't go to the doctor that much. It's probably the closest we'll get.
Can I do a quick little plug as far as what to tell the guys who need to go to the doctor? Like,
absolutely, you do your thing right now.
Okay, yeah. So
this was your time to shine part.
So I'm big on.
Oh, like this is the camera that you would be.
Oh, dope. Okay, so if you are a man, the current recommendations for prostate cancer screening, and this is crazy, but the current recommendations are to not look for prostate cancer. Wild. They say don't look for prostate cancer in a normal man at average risk to get prostate cancer. What that means is if you don't have a family history and you're not black, they recommend against looking for prostate cancer. Now that means it's just a blood test looking every year. Now that doesn't mean if you have symptoms, you should get tested. It doesn't mean that if you have anything going on, urinary issues or pain or something like that, you shouldn't get tested. But they actually recommend against looking. Now, if you have a family history, if your dad has prostate cancer or your brother has prostate cancer or you're black, then you're supposed to start at 40, and every year you get a blood test until 70.
You saying this, but you gotta have to explain why black. It's something to do with black guys and their genetics. It's a little bit different because
So prostate cancer hits us African-American men harder than any other population in the world. We don't know why. We know that the rates are a little bit higher here than in Africa, which is weird. And we think that maybe is due to data, or I think it's because the Middle Passage, the same stuff that my ancestors had to survive the Middle Passage allowed us to also get prostate cancer more. That's what makes sense. But we also don't know. So we don't know why. We don't know if it's the diet. We know it's related. But we don't know, but it does hit us extra hard, extra aggressively, and we die sooner than any other population in the world.
Is that kind of some of the reason that kind of got you and made you passionate about this? No?
I didn't know that before I got into it. Like that was just a lucky byproduct. My dad had prostate cancer, and I'm black, so I started at 35. Getting my prostate checked every year because I was supposed to start at 40 given my race. And then when my dad got prostate cancer, it was like, okay, I'm going to start earlier than that because I have 2 risk factors now. So I'm going to get it at some point. I'm just going to make sure I get it early enough to get it cured. So if you are black or you have a family history, get your PSA done. You used to say you have to get a finger in the butt. You don't have to do that anymore. It's just a blood test once a year. And it's really easy. And then
he said, "Dang."
Well, there goes the excitement.
I mean, we can still do it
in private later, though.
Yeah, I'll get your number later. But yeah, so that's it. And then the other plug for men is listen to your bodies. Right, y'all know when things aren't acting right. We can fix a lot of stuff, and just because you go to the doctor doesn't mean you're weak. Just because you go to the doctor doesn't mean you're like gonna die, or doesn't mean you're not gonna have sex again. That's another thing I do. I help guys have sex until like forever, right? So just because you come to the doctor and you have an issue doesn't mean stuff's going away. We have therapies to help everything and help you get right. So please come see the doctor and don't.
And then also let them know where y'all located at and where your practice is.
Yeah, so I work in Gonzales, Louisiana, which is right outside of Baton Rouge. And so I'm the only urologist there for now. In a year, I'm getting a partner. And I'm very busy, but I love doing this and love talking to guys and love getting guys in. So please give the phone number a call that we wrote down, and we'll get you in if you have any issues.
Well, we appreciate
Awesome.
you. Yeah, awesome. We appreciate having you on, man.
Yeah.
I can't
so
believe
much.
it. Tom flew.
Oh, look, we still got